Well, Fox 5 Health News, the FDA ordering a black box type warning for breast implants and a new list of health concerns saying patients must be warned of the risks. Join us now, Dr. Parikh, Clinical Assistant Professor of Infectious Diseases and Immunology at NYU Langone. Doctor, thanks for being with us. And we know a black box warning is the most serious that the FDA issues, right?
Yeah, absolutely. And in this case, it's significant and important because they found a link between these implants and certain cancers of the immune system, like lymphomas, autoimmune diseases, joint pains, people feeling run down and not well.
Mm-hmm. Now, it's important to note, too, I feel that this is for cosmetic surgery as well as women who may have had breast cancer surgery and then are doing reconstructive. Everyone needs to be aware of the potential risks of this.
Yes, and actually women who've had breast cancer or have had chemo or radiation or plan to need to be even more careful because they're at higher risk. And as you mentioned, ironically, these are the women that might be seeking these surgeries because they've undergone single or double mastectomy. So it's especially important that this warning is coming out and this transparency is there.
Right, so getting implants after cancer surgery can up your risk of the concerns that are mentioned in the black box warning. Well, in general, what's going on here? Is your body sort of attacking something it doesn't really understand why it's in there? Is that the general picture of what's going on?
Right. You know, anytime that there is a foreign body a foreign body inside of your body, your immune system can have an adverse reaction to it. So you have to be very careful. So it can be something like an allergic reaction or even autoimmunity or even cancer. And especially people with compromised immune systems, they're even at higher risk for cancers that may evolve, especially if they've undergone chemo or radiation because their immune systems aren't working as effectively as someone who doesn't have those issues.
Yeah, so that's a huge warning for sure for everyone to be aware of. All right. Well, the CDC now authorizing a fourth COVID vaccine dose for patients with weakened immune systems. Okay, so that's basically what, 6 months after you get your booster, you get another booster if you have a compromised immune system.
Right. And just to clarify, this is a small percentage of the general population. Not everyone is going to need this fourth dose. If you're a cancer patient, someone who's immunosuppressed, I treat patients with non-functioning immune systems. So this is nothing new. Many of them need supplemental doses of even other vaccines. We just don't hear about it as much. It's just their immune systems can't mount the same response that someone that's not immunocompromised can. So it's more for severely immune compromised or moderately immune compromised that may need this fourth dose to protect themselves.
And when it comes to Moderna, the fourth dose is half the dose of 1, 2, and 3, right?
Correct. Yeah. So they're finding that half dose may be enough, that these individuals don't need a fourth full dose. But if you got Johnson & Johnson, they are recommending that you do get a full dose of either Pfizer or Moderna, and then, go from there if you need additional doses with your physician.
Right. Yeah. It seems like if you got one dose of J&J, you're probably not good anymore, and that you really need to get the booster shot. It seems almost like that was maybe underdosed or something at this point, given the waning effectiveness of that. All right. Dr. Parikh, we appreciate your perspective as always. Thank you.